if you had a biopsy today, I'll get the slides tomorrow. But for frozen section, we use it in a case where the doctor requires an answer immediately, within 20 minutes. And those circumstances usually are intraoperative in the operating room. So let's say a doctor wants to remove a breast lump that is malignant, cancer. They want to go around it, and they want to make sure that when they take out the tissue before they close, that they have taken out the entire lump that contains cancer. So instead of going through this whole long process that takes 2 days, we will be able to assess that lump immediately and give them an answer immediately and tell them, you've removed everything, you can close the patient. Or, well, the posterior side, there's still a bit of, you're too close to the tumor, you might want to take a bit more tissue so that we are sure that you've taken out everything and reduces the chances of this patient coming back with a recurrence. Another thing we do with the frozen section is what we call sentinel node biopsy. So when a patient goes into theater to remove breast cancer lump, they also want to check the lymph nodes in the armpit, the axilla, to see whether some of those cancer cells have spread that far. So what sentinel node does is that you just identify one lymph node that you are sure is the first one that drains that breast. And then you take that one lymph node out, you bring it to us, we'll look at it very quickly using the frozen section method, and then tell you whether that lymph node is involved or not. If it is not, you leave that patient alone. If it is, then you can go on and remove the rest of the nodes. So it's also one of those things that are useful in personalizing care, so that you only do as much as you need to do without doing too much and causing harm to the patient, and they really didn't need to undergo such an extensive process.